I don't know what all this is covering. And it says ding, 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 check mark. That is wrong. I gotta be honest. I think maybe they got that wrong. Okay guys, I am done with my prereqs, so I don't have to do any studying, but to be honest, it can be least stressful to study when you know you don't have to. And I am curious, like, how hard is nursing school gonna be? So I've learned from doing my prereqs, it's really easy to look up like practice tests online. So watch if you want me take a practice test. And I don't know what all this is covering because I don't know. It says fundamentals of nursing, multiple choice questions and answers quiz. I don't know if this is chapter 1 of fundamentals of nursing or a certain section or if it's just the whole thing. It says interview preparations, refresher jobs. Oh, that's who it's for. We're going to go through them. We're going to see what I know and why I know and how much of it I know because of Raylan while I eat breakfast. Question 1. It will give me a green check mark by these questions if I get them right, and it'll give me a red X if I get them wrong. I don't know if you get a chance to pick like another answer. A client has been admitted to a nursing home and the nurse completes an assessment. Which finding might lead the nurse to suspect nutritional alteration? So something's wrong with her diet. A, eye clear. To me, that would be a good thing. You want your eyes clear. B, shiny hair. Again, that seems like a good thing. I think shiny hair is good. C, rigid nails. I'm kind of suspecting that one. D, moist conjunctiva. I think, just from being a mom, that conjunctiva means this like your eyelids, like inside your eyelids, because conjunctivitis is pink eye, I think. So you want it moist, right? You don't want your eyes super dry. So I'm gonna go with rigid nails. I think ridges in your nail. And it says ding, 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 check mark. A patient asks you what vitamin is best for eyesight. Your response is vitamin C, vitamin A, vitamin B6, vitamin B12. I know vitamin C is not for your eyes. It's for a lot of other stuff. Can help fight off stuff, thins your blood. Vitamin B6 and B12, those are for energy. Here's how I know that, because when Red Bull was taken off, I watched like a YouTube video about what made Red Bull so popular, and they're like, it's the equivalent of the amount of caffeine in 1 cup of coffee plus B vitamins. And I was like, what if I take B vitamins with my coffee? Wow, it's amazing. You get a lot more energy. Some people say it's placebo effect. I don't believe it. B vitamins, I have to be careful when I take B vitamins. Like I said, I think I've told you guys, I nap during the day sometimes because of my weird sleep schedule. Can't take B vitamins and then nap very easily. I'm going to go with vitamin A. And also, my oldest two have vision impairment. And there's a lot of vitamin A in carrots. They always say carrots are good for your eyes. And I want to say like, the terms retinol, vitamin A sound familiar to me, and I don't know why, but I'm pretty confident that that's vitamin A. And ding, 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 it is. Next, according to Maslow's hierarchy of human needs, the highest level is physiological needs, safety and security, belongingness and affection and esteem and self-respect, or self-actualization. I know that's self-actualization. I know that from psychology class. If I had to give you a short answer of what self-actualization is, I don't think I could anymore. But if it was multiple choice, I'm pretty sure I could pick which one was self-actualization. 4, all the flowing, I think they mean following. I don't know if I know this one though. All the following are essential standard precautions used in the care of all patients, irrespective of whether they are diagnosed as infectious or not, except one. So which one do you not need to do? Hand hygiene, you need to do it. Improper sharps and waste disposal. I mean, you definitely shouldn't do that one, so that's got to be the wrong one. The other ones are personal protective equipment, which now I know is standard, but before COVID, yeah, I guess you still would put gloves on, even if they weren't infectious. So yeah, and aseptic techniques, I think that means like sterile. I don't know what it means, aseptic. I think of like antiseptic. I think that would be good. So I'm going to say improper sharps and waste disposal. You shouldn't like be not careful with needles. And that is right. All the following are indicative of physical signs of poor nutrition, except, okay, which ones are not indicative of poor nutrition? Dental caries, mottled appearance, fluorosis, malpositioned. So if your teeth are not straight, if you have white spots on your teeth, I think that's the fluorosis. And dental caries, I mean, I think that could be a sign of poor nutrition because too much sugar. Brittle, depigmented, easily plucked, thin, and sparse hair. That's definitely a sign of poor nutrition. Tongue, deep red in appearance, surface papillae present. Deep red, I think that could be like maybe a sign of like some sort of illness. I don't think that's poor nutrition. The fourth one is spongy, bleed easily, marginal redness, recession gums. If your gums are spongy, bleed easily, red, and recessed. It's one of the last two. It's either the tongue being deep red in appearance with surface papillae present. Surface papillae are just your taste buds, though, I think. So surface papillae would be present. I'm going to say if your gums bleed easily, I think that could be a sign of lack of vitamin C. I'm going to say the tongue. That is wrong. So, you can click it. The correct answer is brittle, depigmented, easily plucked, thin, and sparse hair. Probably because that's just a sign of old age. Your hair just naturally gets brittle and depigmented and turns gray and is thin and sparse as you age. That makes sense. 1 wrong out of 5 so far. All the following are patient's responsibilities except providing information, complying with instructions, give different kind of care, follow hospital rules and regulations. I would say give different kind of care. I don't even know what that means. That is right though. Yeah, the patient's responsibility is not to give different kind of care. An instrument placed against a patient's chest to hear both lung and heart sounds. Do you know this one? I'm not even going to read all the answers. The answer is stethoscope. Ding, ding, ding. At the end of the shift, the nurse realizes that she forgot to document a dressing change that she performed for a patient. What action should the nurse take? A, complete an occurrence report before leaving. B, do nothing. The next nurse will document it was done. C, write the note of the dressing change into an earlier note. Make a late entry as an addition to the narrative notes. It's either C or D. Can you write a note of dressing change into an earlier note? Or is that like changing medical records? Make a late entry as an addition to the narrative notes. It's at the end of the shift. I mean, it's not the next day. I think it would be write the note of the dressing change into an earlier note, but that could be wrong. Let's see. It is wrong. You can make a late entry as an addition to the narrative notes. That's so that doctors can't go back and change notes if they made a mistake. So you can see what really happened. So I understand why, but I didn't know that one. Changes that occur in musculoskeletal systems due to immobility. I should know this because of Raylan. Decreased muscle endurance, strength, and mass. I mean, that's definitely true. Change in calcium metabolism with hypercalcium result in renal calculi. Raylan has had hypercalcemia. Renal has to do with your kidneys. She has some deposits in her kidneys. I'm not sure if that's due to immobility though. Alteration in calcium fluid and electrolyte. I don't think that would be it. Or D, none of the above. I'm going to say decreased muscle endurance, strength, and mass because I know that's true. And that is. I don't know why. I don't know what causes the calcium metabolism problems. I know she's had some issues with that. One was for sure a side effect of a med she was on. So Raylan helped me with, honestly, I think just one question right now. Stethoscope. Of course I already knew that one. I got it wrong about the nurse note, but I questioned it because of Raylan. I don't know. Some of this I just know from being a mom, being a patient in the hospital myself. Common sense. Development of an infection occurs in a cycle that depends on the presence of all the following elements, except causative agent or a portal of entry. That is needed. Source for pathogen growth. That is needed. You can't have an infection if no bad stuff is growing. C, healthcare worker. I don't think you need a healthcare worker to get an infection. That is the correct answer. D, you need a portal of exit, a mode of transmission, a susceptible host. Sure. Okay, I'm on to page 2. I'm not doing bad, guys. I don't know if it's going to tell me my score at the end. I haven't been keeping track too well. I think I got 2 wrong. I don't remember for sure. Maybe Chris can keep track like down here. Okay, 11. Independent nursing intervention commonly used for immobilized patients include all of the following except, okay, I have an immobilized patient in there, my daughter. So let's see, I should know this one. Active or passive ROM exercises. That means range of motion. I know that from Raylan. Body repositioning and activities of daily living as tolerated. That one definitely is common. 2, deep breathing and coughing exercises with change of position every 2 hours. Yes, Raylan has a cough assist. Like it literally helps her breathe in deep and do this, and you change positions so you don't get bed sores. Side note, we do not change her position every 2 hours. I mean, through the night, If she's sleeping 3 hours straight, so are we. C, diaphragmatic and abdominal breathing exercises and increased hydration. We don't do that one. I'm not sure how increased hydration over normal hydration would help her. I mean, she's not like using up more fluids. And I couldn't tell her to do those breathing exercises. D, weight bearing on a tilt table, total parenteral nutrition and vitamin therapy. Okay, weight bearing, she has a standard. She does that, so I know that's true. Total parental nutrition. I don't know if I'm saying that right, but that's TPN. I know that from my special needs moms group. That's getting food like through your blood if your digestive system can't digest. Vitamin therapy, obviously people who are immobile sometimes get some extra vitamins. So I know it's this exercises thing, and honestly, probably would have got this one wrong if it wasn't for Raylan. What? It says it's not right. What independent nursing intervention commonly used? Which one's not right? Which one's not right? Let's see. Correct answer is weight bearing on a tilt table, total parental nutrition and vitamin therapy. I gotta be honest, I think maybe they got that wrong because I feel pretty confident of my answer. And if you are immobilized, I don't know, maybe immobilized is different than quadriplegic. Well, I got that one wrong. I thought I knew it because I knew all these big words here like total parenteral, I don't know how to say it, but TPN. I knew what ROM is. I knew about causative. Apparently they do diaphragmatic and abdominal breathing exercises and increased hydration. We don't do that for Raylan, but maybe she's different than immobilized. I don't usually hear them use that word for her. Okay, 12, nonverbal massage. Nonverbal message is a mode of communication. I need a massage. Is a mode of communication that include the following, except tone and pitch of voice, facial expression, gesture, and touch. I'm gonna say tone and pitch because that's verbalizing. That is correct. So Raylan, we say is nonverbal. She does make a little bit of noises, but not a lot. But that's right. I don't know what makes you nonverbal if it means you don't have, I don't know. Objective data might include chest pain, complaint of dizziness, an evaluation of blood pressure, none of the above. Objective means measurable. I don't know how you measure chest pain or dizziness. An evaluation of blood pressure, I mean, that sounds measurable. I'm going to pick none of the above just because I don't think it's chest pain or complaint of dizziness. Unless it was all of the above, because you could just count it. I'm picking none of the above. That is wrong. The correct answer was an evaluation of blood pressure. Oh, objective data might include. Yes, okay. That I got wrong from not reading the question closely enough. Include, yeah. So blood pressure is measurable. Chest pain and dizziness is not. Okay. The following is the most important purpose of documentation. Except documentation's purpose: to communicate, to reimbursement, to quality assurance, to provide comfort. Okay. Nurses document stuff. 1, to communicate to the next person what happened. 2, so insurance will reimburse for the services probably. 3, quality assurance. D, they're not documenting to provide comfort. The more documentation they do, the less time they have to comfort you. Ding, 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 ding. I know that. Like when the nurse supervisors come in our home and talk to me about, here's the nurse's paperwork and stuff. Sometimes they tell me the stuff that they need to be documenting, and I'm like, I don't care what the nurses do with paperwork. I'm like, that's on you guys that they're documenting right. I'm like, in my opinion, the less paperwork they're doing, the more time they have to do to take care of Raylan. And actually, I had to get permission from a doctor that they don't have to document every single seizure Raylan has and fill out a seizure log, because I was like, they're never going to put their pen down if they have to do that some days. Documenting does not provide comfort to the patient. 15, the nurse is orientating a new nurse to the unit and reviews source-oriented charting. Which statement by the nurse best describes source-oriented charting? I don't know what this is. Let's see if I can tell from reading the answers. Separates the health record according to discipline Organizes documentation around the patient's problems, highlights the patient's concerns, problems, and strengths. I don't think they want documentation highlighting the patient's concerns. Patient's concerns can be totally off of what matters for getting better anyways. D is designed to streamline documentation. I think it's got to be designed to streamline documentation. My second answer, if I could pick, was separates health record according to discipline. I don't think that's true. D. That's not right. What's the right answer? Separates the health record according to discipline. So like source, if we're talking about heart, we go to the cardiac source. Oh no, I would have got that wrong. I did get it wrong. 16. The nurse is preparing to take vital signs in an alert client admitted to the hospital with dehydration, secondary to vomiting and diarrhea. What is the best method used to assess the client's temperature? There's oral, auxiliary, I think that's auxiliary, radial, or heat-sensitive tape. Alert client. I'm going to say oral. They're alert. That's wrong. Heat-sensitive tape. I know they use those in the hospital. I don't get why. They don't seem that accurate to me, but got that one wrong. It's that little, have you ever seen them put the forehead stickers on you that take your temperature? I actually don't know if I'd seen that until we had Raylan. Anyways, got that wrong. The nurse is to administer an iron injection in an adult. How should this be administered? Subcutaneous in the arm. I think that means just under the skin. Intradermal in the forearm. Intramuscular in the deltoid. This is your deltoid. I know that from A&P. Z-track intramuscular in the gluteal. That means butt. I don't know what Z-track is, but gluteal means in the butt. How should you get iron? I'm going to pick intradermal in the forearm. I would pick that one. And that's where most shots get. I bet it's wrong. Let's see. It's wrong. The right answer is Z-track intramuscular in the gluteal. I don't know what that means. I haven't learned that one. The nurse is working on a unit that uses nursing assessment flow sheets. Which best describes this form of charting? Are comprehensive charting forms that integrate assessments and nursing actions. Contain only graphic information such as input, output. It says IO. I know that means input, output because of Raylan. Vital signs and medication administration. Are used to record routine aspects of care. They do not contain assessment data. It's called nursing assessment flow sheet, so wouldn't believe that one's right. Contain vital data collected upon admission, which can be compared with newly collected data. I think it's comprehensive charting forms. Ding, ding, ding. I think that's what they use in our home. They integrate assessment and nursing action because it has little check marks, but then also has spots for them to write down things. I think Raylan helped me with that one. The nurse prepares IM injection. I know that's intermuscular. That is irritating to the subcutaneous tissue. That's just under the skin tissue. Which of the following is the best action in order to prevent tracking the medication? I don't know what tracking is. I'm guessing it's like coming back out of your skin or something. It says use a small gauge needle, apply ice on the injection site, administer at a 45-degree angle, use the Z-track technique. I don't think it's use a small gauge needle. I don't think it's apply ice on the injection site because I've never, ever seen them do that. It could be administered at a 45-degree angle because I know that some medicines are put in at a 90-degree and some are put in at a 45-degree angle. And I know that because of Raylan, because she had to get a shot one time for her hypercalcemia, and they thought she was gonna stay on the shots for a while, and so I was gonna have to give them at home, and they gave me a paper that taught about shots, and I know there was 2 ways to give shots, and some had to be given at a 90-degree angle and some 45, and I don't remember which Raylan's was, but I know because of Raylan, some are given at a 45-degree angle and some 90-degree. It's either administer at a 45-degree angle or use the Z-track technique. I'm going to pick Z-track because they want to prevent tracking, whatever that is. That's right. What does that mean? I don't know. I don't know what it means. But Raylan helped me with that a little bit. The nursing process is utilized to provide a systematic, organized, and comprehensive approach to meeting the needs of clients. Seems appropriate. Encourage the family to make decisions regarding patient's care. No, that's not the nurse's job. They don't encourage us to make decisions. Increase involvement of allied healthcare professionals in decision making. That does not seem like like the nurse's job. None of the above. It's either A, provide a systematic, organized, and comprehensive approach to meeting the needs of clients, or it's none of the above. I feel like nursing isn't comprehensive, so I'm going to pick none of the above. That was wrong. It was provide a systematic, organized, and comprehensive approach to meeting the needs of clients. That is what the nursing process does. Page 3. How many am I getting right and wrong? I don't know. Will it tell me in the end? I don't know. Chris is probably keeping track while he edits it, but there's a score at the bottom. How bad am I doing? There are many different nursing education programs throughout the world that prepare nurses. Which of these programs is a type of basic nursing programs? Diploma certificate programs, baccalaureate degree programs in nursing, master's degree programs in nursing, doctoral programs in nursing. I'm going to say diploma certificate programs. This I know. That was wrong. I was going to say I know that because of Raylan. Many different nursing education programs throughout the world. Which of these programs is a type of basic nursing program? It's not diploma certificate programs. It must be baccalaureate degree. Yeah. I mean, that's, I guess, a BSN, baccalaureate degree. I mean, I thought LPNs were like licensed professional nurses, but they don't have a 4-year degree. But maybe baccalaureate doesn't just mean 4-year degree. I don't know. Got it wrong. 22. To assessment of the immobilized patient, focus on the following: except range of motion, activity tolerance, body alignment, psychological condition. We're not going to focus on their psychological condition. That is correct. Which of the following is the appropriate route of administration for insulin? Intramuscular, intradermal, subcutaneous, intravenous. Intravenous is in the vein. We don't use an IV to give insulin. Intramuscular is in the muscle. They don't give insulin in the muscle like this. I know from my grandma, they give it like you pinch up some fat and put it in there. Is that subcutaneous or intradermal? I think subcutaneous is how they do the TB test thing, like just under the skin. I think it's intradermal. If it's not, it's subcutaneous. It's subcutaneous. It's not intradermal. Got it wrong. I knew it wasn't intramuscular or intravenous because of my grandma. So I guess subcutaneous is when you pinch up some fat, not here, but pinch up some fat and put it in. That would be subcutaneous. Know that now. Which of the following is the meaning of PRN? I know this one. I knew this one before Raylan because for work at the group home, I think they called them PRN shifts. It's like when you pick up an extra shift just because someone needs to pick up an extra shift. When advice, when necessary, immediately now. It's when necessary. It's like stands for pro re nata or something. I don't know what it stands for, but it's like hey, we need someone to pick up this extra shift. All right. I finished them all. Does it tell me how many I got right or wrong? I don't think it does. Chris will have to keep track. How'd I do, guys? 24 questions. I don't remember how I did. This was a nursing fundamentals multiple choice questions. I don't know if it was like over a general overview of all the fundamentals of nursing or just a section, but I mean, I think I did okay for not having taken the class yet. Let's see. That was fun. Thanks for watching with me, guys.